Hi, we come to you with important guidelines in the monitoring and evaluation of those who are diabetic. So if you're diabetic, please come closer. This time and this guideline are very vital in your pushing away possibility of complications from diabetes. These guidelines would try to remember them using the word diabetes. Each of the letters of the word stands for something. So we'll start with D. Dieting is important. Dietary adjustment and dietary discipline is important. I, investigate key organs in your body that are usually at risk for those who are diabetic, including the heart, the kidneys, the brain. A, acquire blood pressure and blood sugar monitoring devices. B, beware if you don't take your drugs, you can come down with heart failure, kidney failure, stroke. E, exercise and lose weight. C, take your drugs and ensure that your drugs are controlling your blood sugar. E, eye check once in a year. And S, see your doctor every 3 to 6 months. With this, you'll be on your way to effective blood sugar monitoring and, of course, running away and escaping possibility of complication from poor monitoring of your blood sugar. All right, let me take each of these letters one after the other to explain to you in detail what you need to do in monitoring your blood sugar. D, dieting is important. It's important for you to remember that you have to watch what you're eating. A number of those who are diabetic and careless with what they're eating, and they come down with worse complications, difficulty in controlling their blood sugar, and then, of course, they can be depressed because of all of this. Please stay away from simple sugars. Food and drink that contain simple sugar, stay away from them. Things like soft drinks, beverages that are sugar-netted. Also, stay away from fruits that are also sugar-netted, like mango, pineapple, and apple. Try to take more of garden egg and cucumber. That's quite good for you. That's in dieting. In I, investigate key organs of the body that are usually at risk when you're diabetic, and these organs include the kidney. You could do your serum electrolyte urine creatinine to check the kidney. For your heart, you may want to do electrocardiography, what we call the ECG. And for also further than that, you may also want to do your serum lipid profile, which will include your LDL, HDL, and your triglyceride. You may want to do your urinalysis, and of course, you do your blood sugar. As you investigate, A, acquire blood sugar and blood pressure monitoring devices. Please acquire both of them. 73.6% of those who are diabetic are also hypertensive. So as you are monitoring your blood sugar, it's important also that you monitor your blood pressure. Okay, so A, acquire. So B, beware that you may come down with some complications if you do not take your drugs religiously and conscientiously. Remember that you can come down with stroke, you can come down with kidney failure, heart failure, if you do not take your drugs the way you should take your drugs. So beware. All right, beware and be warned. That's B. E, exercise and lose weight. All right, it's important for you to lose weight because weight loss will help in the control of your blood sugar, and weight loss can also help you to live healthy. There are many complications that come with obesity, including cardiovascular or heart-related complications, cancer, and so on and so forth. Please stay away from obesity. Ensure a healthy weight. That's in your exercise, ETES, diabetes. Take your drugs and make sure your drugs are controlling your blood sugar. It's not enough that you're taking your drugs, but please make sure that these drugs are controlling your blood sugar. The other E is eye check once in a year. Please make sure you do your eye check once in a year. And the final S is see your doctor every 3 to 6 months. With this, you're on your way to making sure that you push away complications and you live healthy despite being diabetic.